Hi, I am Dr. Saqib Mansoor, and today I will discuss with you the Baker's cysts, also known as the popliteal cyst. It's a swelling behind the knee, and this is, you could see, this is a schematic diagram. This is the Baker's cyst, and this is the Baker's cyst. You follow the laser, and this is in a cadaver, the Baker's cyst. Baker's cyst is also known as the popliteal cysts. It's a swelling behind the knee, I told you, caused by knee arthritis, herniation, or tear of the joint capsule or meniscus injury. It impairs extension and flexion of the knee joint, and pain gets worse when the knee is full extension, such as during prolonged standing or walking. It is treated by draining and decompressing the cyst. So this is the summary. Let's go in detail. Popliteal cysts are abnormal fluid-filled sacs of the synovial membrane in the region of the popliteal fossa. Baker's cyst is centrally located. A popliteal cyst is always a complication of chronic knee joint effusion. The cyst may be a herniation of gastrocnemius or semimembranosus bursa through the fibrous layer of the giant capsule into the popliteal fossa that communicates with the synovial cavity of the knee joint by a narrow stalk. So let's see. This could you see this is the Baker cyst. You could see this. This is the tendon of the semitendinosus, and this is the medial head of the gastrocnemius. Here you could see this. This is gastrocnemius, and this is the semitendinosus, right? So this is their extension, Baker cyst, the synovial membrane extension. Synovial fluid can also escape from the knee joint. This is a synovial effusion or a bursa around the knee and get collected in the popliteal fossa. Here it forms the new synovial aligned sac or popliteal cyst. Usually there are no symptoms, so it is asymptomatic. If symptoms do develop, these include swelling and pain behind the knee or knee stiffness. If cyst breaks open, pain may significantly increase with swelling of the calf. Rarely, complications such as ischemia, DVT, the deep vein thrombosis, compartment syndrome, or peripheral neuropathy can occur. So let's see what are the risk factors for the popliteal cyst. These are osteoarthritis, rheumatoid arthritis, and the meniscal tears. The underlying mechanism is the flow of the synovial fluid from the knee joint to the gastrocnemius semimembranosus bursa. What is that bursa? The gastrocnemius semimembranosus bursa that results in its expansion. Shown you the picture already. So symptoms can include swelling behind the knee, stiffness and pain. In cases, the cyst breaks open, pain may be increased, and there may be swelling of the calf. I told you already. So, what is a crescent sign? Rupture of Baker cyst can also produce bruising below the medial malleolus of the ankle. What is the cause of the Baker cyst? In adults, knee arthritis, that is rheumatoid arthritis, or cartilage, particularly meniscal tear. I've mentioned already. And what is the cause in children? It does not point to the underlying joint disease. Baker cysts arise between tendons of the medial head of the gastrocnemius and semimembranosus muscles. I've shown you already in the picture. They lie posterior to the medial femoral condyles. The synovial sag of the knee joint can, under some circumstances, cause a posterior bulge into popliteal space, the space behind knee, where the bulge becomes large enough, it gets palpable and cystic. So let me show you the picture again. Yes, here you could see this. This is tendinosis, right? And this is the medial head of the gastrocnemius, right? Usually, Baker cysts keep this direct communication with synovial cavity of the knee, but at times a new cyst pinches off. A Baker cyst can rupture and cause acute pain behind the knee and the calf. I'm repeating it again. And swelling of the calf muscles. About 20% of the people have Baker cysts. They occur usually in those that are having age of 35 to 70 years. Diagnosis, how it is established? It is by examination. A Baker cyst can be easily seen from behind with the patient standing with the knees fully extended It is easily palpated with knee partially flexed. Diagnosis is confirmed by means of ultrasonography, although it there is no suspicion of an aneurysm of popliteal artery. Then aspiration of the synovial fluid from this cyst can be done with caution. Right? You have to differentiate it from aneurysm of the popliteal artery. MRI imaging can reveal a presence of a Baker cyst. A deep vein thrombosis DVT is a potentially serious complication infrequently. A burst cyst results in calf pain, swelling, and redness that mimics thrombophlebitis. And now let's discuss its treatment. Baker cysts usually need no treatment unless they are symptomatic. It is quite rare that symptoms actually comes from the cyst. Mostly there is another disorder in knee, a meniscal tear, arthritis, etc., that it causes the problem. Initial treatment is aimed at correcting source of the increased fluid production. Usually rest and leg elevation are enough. If needed, the cyst may be aspirated to decrease its size, then injected with a corticosteroid to minimize inflammation. So the corticosteroid is very helpful. So finally, the surgical excision is performed for cysts that produce great amount of discomfort to the patient. So treatment continues. A ruptured cyst is treated with rest, leg elevation, and injection of a corticosteroid into knee. Exercise. Many activities put strain on knee and produce pain in a patient with Baker's cyst. Avoiding activities such as kneeling, heavy lifting, squatting, climbing, and even running in help prevent pain. On the other hand, some exercises may help to relieve pain, and a physiotherapist can instruct on hamstring stretching to decrease pressure on the Baker's cyst, and strengthening exercises for the quadriceps and the patellar ligament. And here you could see a beautiful picture again. It showed you already a Baker cyst in a cadaver, right? This is the lateral aspect, and you could see, follow the laser. This is the lateral aspect, and this is the superior aspect. Here is the inferior. Obviously, this is the medial one aspect. So this is the Baker cyst in a cadaver. So this is in the last a summary of the Baker cyst. What are the symptoms? None. Swelling behind the knee can be there. Pain can be there. And the complication, DVT, deep vein thrombosis, ischemia, peripheral neuropathy, compartment syndrome. And what's the usual onset? It is gradual. Risk factors, the predisposing factors, knee problems like meniscal tears, osteoarthritis, rheumatoid arthritis. And the diagnostic method, very important, confirmation done by ultrasound or MRI. DD, the differential diagnosis, deep vein thrombosis, DVT, aneurysms, like the popliteal aneurysms, ganglions, the tumors. Treatment. The treatment is, as I discussed already in detail, it summaries supportive care, aspiration, and surgery. What is the frequency of the disease? It's about 20%, not very less. So thank you very much for watching the lecture. If you like, please do subscribe. Take care of you and goodbye.